Now the workflows of the tasks. So the task help put together certain workflows that assists the community health workers in doing their job, where there is a certain flow to what they do. So for example, a community health worker could go to a household for a visit, and they find in that household there's a woman who is pregnant, and they will register that woman using a pregnancy form, which could be accessed through the action button that is within the person's profile. Once they fill in that pregnancy form, there could be a task that appears perhaps a month from that date that reminds the community health worker to go to that household again and confirm that the woman went for an antenatal care visit. And in that way, they're able to do that or to follow up without necessarily having to write it down somewhere or keep thinking about when they're supposed to go, or perhaps even forgetting because they have other things that they're doing. And then once they perform that or they complete that task, there could be another task that could pop up. For example, if they fill in within that visit that there are certain danger signs that have appeared within the 1 month since registration. So this is what we call a workflow from the initiation of the pregnancy and all these follow-ups that will happen after that, to perhaps the delivery, or even after delivery to the postnatal care visits that the woman will go for. So all these happen sequentially, and there are things that are built into the community health toolkit based on the specifications that would be set by a service designer. So the data or the form could generate several tasks at once, where, for example, with the pregnancy registration we've just talked about, there could be multiple ANC visits. There could be one ANC visit every month that is triggered by the one form. Or you could have the pregnancy registration trigger one ANC follow-up, antenatal care follow-up, and then that antenatal care follow-up could trigger the next one. So all this depends on what the designer sets as a specification of the behavior or of the community health toolkit. And there we see an example of sequential forms and tasks, such as the child health assessment form, which will trigger a follow-up task 48 hours later. And then after that, you could have a referral form that is triggered if the child's condition hasn't improved. And then after that, you could have a referral follow-up task to confirm that the child went to the facility for the referral.